Very nice.
Well, tonight from the 8 on Your Side team, the incidence of some cancers has dropped, but not so with thyroid cancer.
It increased more than 6% in a 10-year period. Tonight, medical reporter Susan Shapiro shows you the warning signs.
Denise Wilber has been making the rounds of doctors.
Thyroglobulin is a substance that comes from thyroid tissue.
The 43-year-old underwent a thyroidectomy in December, the surgical removal of her thyroid because of cancer.
When we treat you for the thyroid cancer, we want to keep it low.
When you first are told that you have cancer, you freak out.
But lucky for Denise, thyroid cancer is usually very curable.
This is a normal-sized thyroid gland as it sits around the trachea, just below the larynx.
Endocrinologist Charles Rost says the butterfly-shaped gland makes thyroid hormone, which helps control your body's metabolism. While it's still relatively uncommon, studies have shown a significant increase in the incidence of thyroid cancer. No one is quite sure why.
I think that the better screening plays a bigger role in it. I don't know. I think there probably is something more than just that, but I think that the better screening plays a role. The increased incidence of the thyroid cancers.
It makes you think, is it 3 Mile Island, or, what's going on in this area that's causing all this? And, I've known 3 people in the last year that have had thyroid cancer.
This is an ultrasound.
Denise's cancerous nodule was spotted during an ultrasound for a carotid artery tear. Most thyroid cancer is usually picked up incidentally.
This is the trachea, so you're looking here in the lobe of the thyroid gland where you see the nodule that the radiologists have marked for us.
As part of her treatment, Denise has to take a radioactive iodine pill. It's 4 millicuries. That's about as much radiation as in a chest x-ray. The pill is delivered to the hospital in this heavy lead container. It comes inside there.
It's such a small dose. When you fly on a plane, you probably get more radioactivity.
Are you doing all right? Okay.
She then had a full body scan, highlighting any remaining thyroid tissue since her surgery.
This is what we're going after right there, that little spot.
Days later, Denise took a megadose of radioactive iodine to ablate or destroy that leftover tissue. During that time, she had to stay at a distance from family and friends. Denise is feeling a lot better now. She will have to take synthetic thyroid hormone for the rest of her life. And she may always wonder why she's one of the growing number of thyroid cancer survivors.
I would love to know what really causes it.
Susan Shapiro on Your Side, News 8.
Thyroid cancer is more common in women, but the increased prevalence seems to be occurring in men and women.